Thank you for inviting me to speak about the Moore survey. Just a little bit forward on my clicker there, so thank you for inviting me. I hope that you find this informative today, talking about the mesothelioma outcomes research experience survey. Reposition myself to see the slides, which are rather small for me. I'm going to pass through this slide because this is really just an update on mesothelioma UK. As you can see, the Moore survey was a survey conducted in the first half, actually, of 2019. So that was completing around about the summer of last year and took us some time to report on. It was Mesothelioma UK's second large-scale survey, really comprehensively capturing real-world experience of patients from diagnosis and through treatment and care. Moving on then. The questionnaire was divided into 3 sections, as you can see. One was the patient experience of care and treatment. Secondly was a quality of life assessment tool, which was the EQ5DL. And thirdly, the individual clinical management of mesothelioma. Now, the survey was registered with each NHS trust via the mesothelioma nurse with the clinical audit department in that trust. And patients were able to access the survey via a tablet, via a web mesothelioma website, or in a paper survey. The clinical management survey, which was section 3, had to be validated by a CNS, and all the data was anonymous. So this is just a picture to show you where the 28 nurses we have to date are based across the UK, very much in a hub and spoke across Wales, but I'm very glad to say that we now have a hub and spoke across Scotland, and 2 posts are awaiting in recruitment for Essex and Edinburgh. So the patients were recruited, and I do want to stress it is a survey, and they learnt about the Moore survey from other patients, from the CNS, from support groups, from asbestos support groups, and from Mesothelioma UK via social media. Now, we had in total 503 responders. We actually had more responders than that, but we could only validate 503. And I'm very glad to say that of those numbers, there was 32 Scottish responders. I just want to make clear as we embark on the results that this was a survey, so it's not like the hard and fast data that we've been delivered from Phil and Rocco and Anna. So it is a survey answered by the patients, and it's the patient's responses. So as you can see here that we had 289 patients who were over 70 in the whole of the survey, and in Scotland was 19 of those patients. Also, this was by gender. Of the 32, 2 were female and 30 were male. As you can see here, there's no surprises here in the number of patients by site of diagnosis, with left pleural and right pleural, the right pleural being slightly larger number, 2 peritoneal and 1 who did not identify the site of disease. Looking here, you can see the slides are very, very small for me, guys, in the events team. So I'm just relying on paper copies next to me as well. But as you can see on tissue diagnosis, that we had 84% of Scottish patients had epithelioid, 3% were sarcomatoid, and 13% were unspecified. Now, this only really differed with the national data. In the national data, we did have some mixed and biphasic patients. clicker's gone to sleep on me here. If you see there, that's great. Thank you very much, guys. That's much better for me. This slide just shows the complexity of the number of investigations that were undertaken and what the patients go through to actually get through what we hope will be a tissue diagnosis. So we looked at occupation and we looked at the exposure. In Scotland, we had 2 electricians, 3 engineers, 4 carpenters, 1 lagger and 1 plumber. And interestingly, in Scotland, we had 1 teacher. Sadly, 8 patients left this survey blank and 8 patients reported being of other professions. So it did leave a little bit of a gap there in occupation and exposure. Now, moving on to the data that we had, which we class this as real world data because it is obviously from the patients. And on these slides, you will see the national data alongside the local data for Scotland. So we looked at patients who had attended the GP 5 or more times before referral, and that was 2 of the responders in Scotland. We looked at those who had attended hospital 20 or more times over the last year, and that was 6 of the 31 responders in Scotland. Those who'd been admitted to hospital 5 times or more in the last year was 2, and those who had had more than 3 CT scans in the last year was, as you can see, 13. So moving on, we looked at managing the symptoms. 18 of the 31 responders had experienced pain. So 58% experienced pain, 53% experienced breathlessness, 61% experienced fatigue, and 58% experienced cough. Now, this slide shows the experience and how the patients identified their experience in what had been done for them to help them in as much as possibly could by their doctors and nurses. So these results are based on those patients who answered yes, and yes, they did to some extent. So 94% thought that their doctor and their nurse had done everything they could do to help with pain. 88% thought that everything had been done to help with breathlessness. 74% everything to be done regarding fatigue, and 56% everything that could be done regarding cough. Not understandably, with cough being the more difficult symptom, perhaps, as we would say, to help with. So moving on to managing the pleural symptoms. Again, of those patients that answered this question, 24% had had pleural fluid drained more than 5 times. 50% were offered an indwelling drain, and 19% actually had an indwelling drain. Moving on to look at communication and support. 25% felt that they had been told their diagnosis in a way where it could have been delivered more sensitively. 6% had received some support regarding end-of-life planning, and 19% had received information regarding the role of the Procurator Fiscal. Moving on to treatment, 66% of responders had had chemotherapy, 6% of responders had had immunotherapy, 6% of responders had had radiotherapy, and none of the responders had undergone 3 lines of systemic treatment. Looking at surgery, as I said, remember this is a survey very much at odds, I think, with Rocco's data earlier. Those who had had surgery were 3 of the 32 responders, which accounted for 9%. And those who had had a surgical biopsy were 14 of the responders, which accounted for 44%. This is just another slide to show the amount of the treatment and the way that the treatment had been given. And you can see that 3 had not had any treatment at all. Moving on to trials, which was very interesting, reflecting on our earlier sessions, of those that had had clinical trials discussed with them, 38% had had clinical trials discussed at the time of diagnosis, 16% had had trials discussed during their treatment, and of those that had been enrolled in a clinical trial was 28%. So, bringing some of these to conclusions, I think we can see that Scottish patients had less visits, being at 19% versus 26% of the national cohort, and less CT scans at 41% versus 64%. 24% of Scottish patients had had fluid drained 5 times or more versus 16% in the national cohort. However, 50% were offered an intrapleural drain versus 31% nationally, and 19% versus 13% had actually had an intrapleural drain. 25% of patients felt their diagnosis could have been delivered more sensitively. Perhaps a reflection back to what Julie was saying earlier, but I think we've massively moved on from then. Regarding treatment in Scotland, 66% had chemo versus 76% on the national cohort, 6% versus 11% on immunotherapy, and 6% versus 9% on radiotherapy. So very much a muchness there, I think we can say. If we're looking at surgical diagnostic procedures, 44% in Scotland versus 40% in the main cohort, in the national cohort, and resection was 9% versus 17%. Again, remember please that this is patients who took part in the survey. For Scottish patients entered into clinical trials, it was 28% versus 31% nationally. And 19% of patients were informed of the procurator fiscal, which was less than the 27% in the national cohort who were informed about the role of the coroner. You may want to tease out some differences there, which I've reflected back on our previous sessions earlier. And for end-of-life planning, it was 6%, or support towards end-of-life planning seemed to be given by the doctor or the nurse. It was 6% versus 9% in the national cohort. So going forward nationally, we need to do some further work on the group analysis of the EQ5D5L. What we do want to do is take the MORE survey forward onto a digital platform. We're doing some work along the roads of this called MesoDAX, and we would like that to be integrated into the National Mesothelioma Audit. So this would be where patients were consented to fill in data at a period that was fitting to them, maybe monthly, maybe 3 monthly, on their treatment, on their burden of disease, on quality of life survey. And then we would have information going forward to really monitor our patients on a very large scale. So looking at our findings from Scotland, there appeared to be less hospital visits and less CT scans within the last year. That may be good, that may be bad, very much up for discussion in the time of COVID. And I think if we'd have been doing the survey this year, obviously, that question would have probably been blown out of the water. Pleural effusion management in Scotland, it seemed as if patients were more likely to have an intrapleural catheter or an intrapleural drain going through the cohort that we spoke of during the time. It appears that less patients in Scotland are having surgery. Rocco's data obviously doesn't reflect that, and so that's an important point to establish. And I think across the board we need to improve communication and end-of-life care planning and support for our patients. Sorry, my clicker keeps timing out on me. So here now we have just an image of how we would like to take a platform forward, a digital platform where patients could actually talk about their experience and give us some hard and fast real world data to go on with and manage their care. just leaves me thanks to give some thanks and acknowledgements to all of the Mesothelioma UK Scottish CNS team who were really helpful, to Anna Morton, who did a brilliant job of disseminating and the survey to people and those that would be able to pass the survey on. I think that's another reflection of how this network has really taken off. I'd like to thank Alicia Riley and our ops team who prepared some of these slides for me, the asbestos support groups who helped out. Dash Global and SNAP Surveys were our partners. Bayer PLC gave an initial grant to get us started, and Euroqual for allowing us to use the EQ5D5L tool, which, as I say, we need to do more reporting on. But mainly, my thanks go to the patients and their families who let this survey, the MORE survey, take part. Thank you.